tips for having intimate conversations with your partner, plus subtle signs someone may be attracted to you. Everything you wanted to ask about sex but didn't. Now you can ask Dr. Leah, sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, the lady in red, Dr. Leah.
Thanks, Derek. It's great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Plus, we have a special guest here to reveal how he helps patients manage their hormones. But first, let's take some viewer questions.
Absolutely, Dr. Leah. You know, you've always stressed the importance of communication, and I think this first question has to do a lot with that. A viewer wants to know, how can I have a conversation with my partner about trying new sexual experiences or fantasies without making them feel uncomfortable or pressured?
You have to pick the right time to have that conversation. Immediately before or after having sex may not be that time. Even though you are both in the mood, ask about trying a new experiencing or fantasy may make your partner feel pressured or vulnerable. Watching an erotic movie or sharing a glass of wine by candlelight could put your partner in a receptive mood to discuss each of your fantasies. You might start talking about your own and then ask them about theirs.
So how do you make sure they don't feel uncomfortable or pressured?
Well, once the conversation begins, make sure you listen to the reasons and see if they're opposed to trying new things. They may feel awkward or they may have had a bad experience. Ask them to explain their feelings. If they seem like somewhat open, try suggesting a simple fantasy for what they can do for you and see how that goes.
Great. Our second question, Dr. Leah, a woman wants to know, how can you get an HPV vaccine in your 40s? Before you answer that, can you just, for the people who might not know, like myself, can you define HPV? What does it mean?
It's human papillomavirus.
Okay.
So the HPV vaccine is really not recommended for anyone over the age of 26 because many adults have already been exposed to HPV, and the vaccine can be less beneficial at that point. However, if you're between the ages of 27 and 45 and you choose to get one, if your doctor and you decide that you're at risk of an HPV infection.
If many women have been exposed, how common is HPV?
Well, studies show that nearly 80% of both men and women get HPV at some point. Most of the time, your immune system will clear up the infection, but if it doesn't clear, there's a chance that you could develop cancer.
So if you get the vaccine, are you safe from getting HPV, Dr. Leah?
Well, be aware that the vaccine doesn't protect you from every form of HPV, so it's important to keep getting Pap tests and HPV tests. Women between 30 and 64 should have both every 5 years or a Pap test every 3 years if you're between the ages of 21 and 29.
That's great advice. This brings back memories, this question. A viewer says, I have this hickey, usually like right here, that won't go away, and it's been a few days. How can I get rid of it?
I don't even want to know what memories that's bringing back. But you can bring down the swelling by putting an ice pack on it for the first day or two. Wrap the ice in a towel and hold it on your skin for about 15 minutes several times a day. Then you want to switch to a warm compress after the second day if needed, and that should help.
What about some makeup, maybe?
Oh yeah, you can use makeup to cover a hickey. Pick a makeup tone that is based on the color of the hickey. So a yellow tone will cover those purple bruises and a green tone will hide that redness.
Okay, so let's just say this is a recurrent problem for whatever reason. Do you have any suggestions for preventing hickeys other than say, hey, back off, man, leave me alone?
Yeah, I was gonna say, if you want to prevent a hickey, communication with your partner is the key, right?
Course, yeah.
Like, ask them to be more gentle or suggest they move to another spot if they're spending too much time in one area that's going to cause a bruise.
Absolutely. They don't look great, but is there any danger in getting them?
Surprisingly, actually, there is. A hickey can cause a blood clot either in the vein or artery. If a clot forms in an artery, it can cut off blood flow to your heart or to your brain, which could lead to a heart attack or a stroke. There are actually 2 different cases where they led to very severe instances, one leading to death, neither of which were in the United States, but it absolutely does happen. But before you freak out from getting hickeys, it is extremely, extremely, extremely rare. You are much more likely to get struck by lightning. 50 people in the U.S. every year are being struck by lightning. So you're much more likely to have that. Actually, 50 people in the U.S. die from being struck by lightning, about 300 being struck by lightning. So way more likely than actually getting a hickey.
Well, something that looks so innocent could be so serious, but okay, it happens though, right?
Again, rare. I mean, you don't have to freak out about it. it, but I don't get the allure of having multiple hickeys all over yourself. I don't necessarily think it's the most professional look. So, you might want to tone it down a little bit.
Got it. Thank you, Dr. Leah.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to askdrleah.com.
Still to come on Sex Talk. Erogenous zones. Taking it to the streets. Signs someone is attracted to you.
There are a lot of areas on your body that can lead to pleasure, considering several areas involve nerve endings that allow us to feel those sensations.
Erogenous zones are areas of the body that contain a high concentration of nerve endings, making them particularly responsive to touch and stimulation. When these zones are stimulated, they send signals to the brain, triggering pleasurable sensations and potentially leading to sexual arousal. Take, for example, the lips. This is why kissing, nibbling, and gentle biting can create a range of pleasurable sensations. And the neck is another erogenous zone that responds well to gentle kisses, light caresses, or even the warmth of breath. The inner thighs, which are in close proximity to the genital region, are incredibly sensitive. Gentle caresses or teasing touches can build anticipation and enhance arousal. Other erogenous zones include the breasts and nipples, ears, and the general area. Pleasurable areas can be different from person to person, but keep in mind that exploring erogenous zones is an intimate and personal journey, one that requires open communication and consent.
What feels good varies from person to person. Exploring other erogenous zones can be an exciting way to connect with your partner. Still to come, a doctor shares how he helps patients manage their hormones. And a viewer wants some tips on motivating her partner to get in shape. That's next. On dating apps, what's like green flag, red flag?
I don't like people that put out there they're just looking for the right vibe and sex positivity, and I don't know. You gotta have a little more imagination than
So
that.
overly cheesy.
I don't like when they have, too many drinking photos, I guess.
A red flag is when you see a profile and the pictures are with a bunch of people. Okay. Not just the one person. It's like you're trying to figure out who it is.
Oh. What is the most thoughtful gift that you have given or that you've received?
Well, I gave him one time.
All right.
I gave him a hat with my face on it one time, and he loved it.
I'll tell you what, this sounds like everybody's done it, but like me growing up, never been to Disney. And I was, 25? I don't know how old I was.
You're 25.
Yeah, like right around that age. So it's kind of awkward going to Disney for the first time. But she had a whole thing planned, and we did around the world at Epcot, and I had just an amazing time. I thought it was so cool.
The most thoughtful thing she's ever given me, she gave me a book. I put together a book of moments.
It was like Why I Love You and different,
and
it was specific to us.
And it was almost kind of like in a, cartoon form, kind of the way the layout, but it was just
kind of
amazing.
An animated book.
Oh, I love that. Welcome back to Sex Talk. Today we have men's sexual health expert who is chief of urology at Baptist Health South Florida, Dr. Daniel Martinez. Thank you so much for joining us.
Thank you for having me. Very excited.
Awesome. So we are here to discuss hormonal abnormalities. First of all, what are the most common hormone abnormalities that you're seeing?
By far the most common abnormality that I see, in my practice at least, is men showing up with abnormal testosterone levels. I see guys as young as 18 years old, men as old in the 90s. Across the board, I think we've become a society that's obsessed with testosterone, and so really it's become this this new norm for everybody want to check their T levels. And because of that, that by far is the most common abnormality that I see.
I see that in my field as well. Can you describe the lasting impact of having a hormone abnormality?
Yeah, I think when a guy's hormones are out of whack, it's really going to throw a monkey wrench into their quality of life. A lot of these guys, they just feel fatigued all the time. They're complaining about low sex drive. They're just not thinking appropriately. They have this mental fog. And long term, it's bad for your heart. It's bad for your brain. It's bad for, you need to have homeostatic levels of these androgens to be able to live a normal, healthy life. And all these things that people talk about, that, testosterone can put you at risk for heart attack and stroke. Well, you're at risk long term if you have low T.
Well, so how are most people finding out that they have these hormone issues? What are their major symptoms outside of just the exhaustion ones that you mentioned?
So if you look at a list of the different hormones that testosterone controls, or the symptoms and the actual things that testosterone controls as a hormone, most guys will present with, from head to toe, mental fogginess, changes in their voice, muscle weakness, fatigue. A lot will present with issues in the bed, with erectile dysfunction, low libido, issues with orgasm and ejaculation, depression. So it's a number of different, I'd say it's more of like a combination of different potential symptoms that these patients are presenting with, not just one in particular.
So what are the most common tests that you use to look for either low T or any other hormone imbalances?
So the way that we figure out if somebody is hormonally imbalanced is through blood. It's an early morning blood draw before 8 a.m. I tell all my patients got to be bright and early, nothing to eat or drink past midnight, and it takes about 2 weeks for us to get those results. And it's not just testosterone we're checking. We're checking total and free testosterone, because testosterone most of the times is bound inside your blood. We also check the estrogens. Yes, men also have estrogens. We check their pituitary gland function, so we check the prolactin, FSH, and LH. These are all things that are part of this whole process of your body trying to make normal levels. And so this is all done through the blood.
So what should viewers do that want to be proactive and really prevent any hormonal imbalances?
The best thing you can do is what every doctor tells you. Just live a healthy lifestyle. Eat healthy, balanced, a well-balanced diet, exercise. Don't put anything bad into your body, the drugs, the alcohol, the smoking. Get a good sleep. So much falls on sleep. When we're sleeping, our body's refueling. And so if you're not getting good sleep because you have sleep apnea or you have bad sleep habits, that unfortunately can create an issue such as hormonal imbalances. But if they want to be proactive and check, just ask your doctor to do the blood test. Any doctor really can order it. It doesn't have to be the specialist like myself. You can do it through your primary care. And just by drawing these labs, doing your normal blood things that you would do every year, you'll know.
Awesome. Great. Well, thanks, Danny. Stay with us. We'll be right back with more Sex Talk.
Still ahead on Sex Talk. Reversing a vasectomy. Can oral sex cause infections? Clues someone is attracted to you. Importance of staying lubricated. When anal sex is too painful. Shaping up for better sex.
Back here on Sex Talk. Now let's take some more questions from our viewers.
More than happy to, Dr. Leah. A man wants to know, how can I get someone pregnant after a vasectomy?
Well, there are ways to get someone pregnant after having a vasectomy. One way is with a vasectomy reversal surgery. A surgeon reconnects the tubes that carry the sperm from the testicle into the semen. Whether reversal is successful or not depends on many factors, including the time since the vasectomy, the partner's age, and if you've had fertility issues before your vasectomy.
And how involved is that? I mean, does it hurt? So we'd be worried about that?
Well, actually, I know people that have done it, and people say that it's not as painful, but that's not what I've heard from the men that have done it. They've been pretty sore and complaining for days, so.
Okay, well, what's another way to get pregnant after vasectomy?
Well, another way is to go through IVF when a sperm is taken from the testicle with a small needle. The procedure usually takes about 30 minutes and there should be no severe side effects. Although, again, I know a man that did this and was also in pain for many days, icing his testicles for quite a while. So the live sperm is separated out from the dead sperm. One sperm is injected into the female's egg through in vitro fertilization, and the embryo is then transferred into the female's uterus.
Our next question, Dr. Leah. A woman says, whenever my partner and I have oral sex, it throws off my pH levels and makes me smell different. What can I do?
Well, first understand that the pH levels of your vagina can be thrown out of balance for a number of reasons, and that includes sex. Your pH level should be between 3.8 and 4.5, which is moderately acidic, and sex can change your pH levels since semen is more alkaline. The change can lead to yeast infections or bacterial vaginosis, also known as BV. It's a vaginal infection that causes the pH levels to become less acidic. And according to one study, there is a link between BV and oral sex because of the bacteria commonly found in the mouth.
I'm going to ask you what some of the signs of BVI are.
BV symptoms include a thin, foamy vaginal discharge that may have a fishy odor. BV can be cured most of the time with an antibiotic prescription. BV isn't harmful by itself, but it can increase the risk of more serious infections like HPV and HIV.
Okay, so what should this viewer do?
Well, definitely you want to check in with your doctor to find out what's causing these changes in your vagina. But if people typically will have recurrent episodes of either yeast infections or BV, and there was a study that showed that people had less significant reoccurrences if they used boric acid suppository for 6 days following their period. Reason being, period also changes the pH of the vagina, making it more alkaline. So people are more likely to get BV or even yeast infections following their period. But it's really important to make sure that it is a suppository. You do not want to swallow boric acid. That can be deadly. So only use it as a suppository. And there are capsules that you can buy.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to AskDrLeah.com.
Ever wonder if someone's attracted to you or maybe they're just being nice? Well, we have some of the cues you might be missing.
Have you ever found yourself wondering if someone is attracted to you? The world of human attraction can be complex and filled with subtle cues and unspoken gestures. When it comes to attraction, body language can reveal more than words ever could. Paying attention to these nonverbal cues can provide valuable insights, like if someone has prolonged eye contact, if they mirror your body language, or if they try to subtly get closer to you. When someone is attracted to you, they tend to give you their undivided attention and engage with you in a meaningful way. If they're attracted, they may smile more and show a genuine interest in what you have to say by actively listening and asking you questions. While deciphering someone's attraction may be an intriguing puzzle, it's important to remember that these signs are not foolproof and can vary from person to person. Context, cultural differences, and individual personalities play a significant role in how attraction is expressed.
Keep in mind, everyone's behavior is different. Sometimes the easiest way to find out is simply to ask. Let's take on some more questions.
Dr. Leah, this next question made me squirm a little bit. A woman says, whenever I have sex, my vagina tears and becomes sensitive. What can I do?
Well, one of the most common causes of tearing is not enough lubrication. Lack of lubrication also causes tears, but can lead to pain during intercourse and put you at risk for infection. So if you're not using a lube, do so. And if you are, try using some more or try using another brand. You could also use lube after sex as it can have a soothing effect, but stay away from lubricants that contain alcohol because that can actually sting those tears.
Let me ask you a question about these tears. Are we talking more like micro tears, or they might need stitches like when you give birth? I mean, I don't know.
I've never heard of sex causing stitches, so this isn't like childbirth or anything. Okay. Sorry, men, you just aren't that big. The men think that they are. No, we're talking small micro tears.
Okay, so what are some of the other possible causes?
Well, you could be getting vaginal tears because there might not be aroused enough, right? So if you're not aroused enough, you're not going to have enough natural lubrication. So take some more time with foreplay. Tell your partner what feels good for you and just take it slow. If your partner is well endowed, they could be hitting your cervix during sex. You can prevent that from happening by using certain positions where you can control the amount of penetration, like if you're on top. While uncommon, you may be having an allergic reaction to lube, semen, or latex if you're using a latex condom. Talk to your doctor to see if you're allergic to any of these.
Thank you. A viewer says, Dr. Leah, I've been experiencing pain or discomfort during anal sex. Are there any tips or techniques to make it more comfortable and enjoyable?
Well, anal sex can be pleasurable if done with gentleness, open communication, and of course, mutual consent. But feeling pain isn't unusual. In one survey, over 80% of people said that they experienced pain, and more than 60% said that they actually had to ask their partner to stop because of the pain. Some reasons anal sex can be painful are hemorrhoids, lack of lubrication, or maybe just the sphincter muscles of the anus are just too tight.
So, Dr. Leah, is there any way to prepare?
Well, if you haven't had anal sex yet, you should start with a conversation as to why your partner wants to have anal sex, whether or not you've both been tested, and if you plan on having more than one partner. Talk about ways to make anal sex more pleasurable.
Again, communications. Any tips for decreasing pain during sex?
Well, number one, use enough lubricant. If sex starts to feel uncomfortable, stop and add some lube. Oil-based lubes last longer, but remember they can damage condoms. So you want to start slow because it reduces the risk of injury. Try using either fingers or a very small sex toy at first and then work up to penetration. You can relax your anal muscles by gently pushing down like you're having a bowel movement, and this might make penetration easier. Be sure to communicate with your partner if the sex starts to hurt and tell them to slow down or stop. And do stop if there is any blood or any severe pain. Also, you want to make sure to wash your hands or penis after penetration. That goes for sex toys too. Be sure to wash them before and after using them, especially with anal sex.
Dr. Leah, you mentioned blood. There might be a little bit of blood and it's not that serious. I mean, could that happen?
Yeah, if there's a small amount of tearing, if there's a tiny amount of blood, then that might not be that serious, but you still want to stop, right? That's obviously an indicator of an issue, so you don't want to, this is not one you want to push through the pain.
Our last question of the day, Dr. Leah. A woman says, for the last couple of years, my husband and I haven't been too active, but I'd like to get into shape for better sex. How can I motivate my husband to get in shape with me?
Well, how about asking him to go for a walk with you? Walking is a great way to increase your heart and lung fitness, and it's also an easy way to start getting in shape. I'm a big fan. Try couples exercises, right? You can both encourage each other while you do them, and it definitely makes working out more enjoyable.
For example, what's an example of exercise that you do together?
Well, you could try a ball toss where you kind of crunch, throw the ball, then the other person goes down, crunching, throwing the ball. Or plank claps, which I love those. You're standing here and then you just kind of clap each time. Or a high five push-up. So you're doing a push-up, high five, right? So after each set, you're engaging in contact, right? Plus there are non-traditional exercises like snorkeling, kayaking, stand-up paddle boarding, or even just going to the gym together. So my husband and I go to the gym together at least 3 times a week. I'm somebody that needs to listen to music, so typically I go in and put in the earplugs and then do my own thing. But it's still nice to see your partner there and communicating, even if it's briefly, even if it's not the couples exercises.
You know, I've done that clapping one before, and she always beats me anyway. But anyway, I give up first. Anyway, the internet can be a great source for ideas, right?
Yeah, I mean, absolutely. YouTube is a great way to look at it. If you're not sure about using a workout routine, a lot of gyms also have it on their website. Or you could try group fitness exercises where an instructor leads the class through a workout. Fun fact, I've actually been teaching group fitness classes for 22 years. I started off teaching hip hop at University of Florida, and I still teach a class a week just for fun.
And you do that because it helps with sex, correct?
That's not the only reason, but you are right. Exercise does help with sex. Exercise can increase circulation, blood flow, of course, increasing testosterone, and it helps boost self-confidence. It also can help reduce stress and anxiety, and those are major mood killers.
Do you think this woman should bring up the fact that she wants them to get in shape, or doesn't want to hurt his feelings, or try to trick him into being active?
I'm not a fan of tricking anybody into anything, although at least you're trying to go for a healthy lifestyle. At the same point, I guess it depends on how sensitive her man is. So if you're really pushing exercise, he might get offended. But if you come from an approach of saying, all the benefits of exercise and say, hey, let's get healthy together, I think that's the best bet. Well, Derek, that's all the time we have for today, but you can still send in your questions. I'm Dr. Leah Janine, and we'll see you next time when we answer the questions you always wanted to ask on Sex Talk.